those cases, of those positives, right now we have 32 hospitalized, 7 of which are in critical condition. We had our 4th death yesterday. A 44-year-old man with underlying health conditions passed away yesterday, so that brings it a total of 4 fatalities. Our Office of Consumer Affairs complaints are up to 159 for price gouging. 34 of those have take your normal precautions if you can. You do not want to be in an emergency room right now unless you absolutely have to. So just changing gears, we're here at our Veteran Services Agency here in East Meadow to draw attention to our 55,000 plus veterans who make Nassau County home. This is already a vulnerable population. So we announced a few days ago that our Department of Social Services is up and running. And I want to assure our veterans and their families that our Veterans Services Agency is also open and continuing to serve veterans. Of course, we have some modifications in place to protect our staff, some of whom are veterans themselves, and to keep our veterans safe as well. But we're still offering critical transportation, food, and counseling services here. I want to thank especially Ralph Esposito, Paul Vista, and the entire team at the VSA for continuing to serve and doing such a wonderful, wonderful job. So we're all seeing on the news how grocery stores are out of supplies, low of supplies. Our VetSmart, which has supplied food to close to 10,000 veterans and their families just last year alone, is starting a new drive-up program right here in East Meadow, so that staff and volunteers can just come out and deliver food right to the car. I want to thank Long Island Cares for helping us to replenish the VetSmart. We want to make sure we have enough food for our veterans. If you can't get here, if you can't ride here, volunteers are starting a new program to deliver food to your home if you are a veteran. We also have, the Veteran Service Agency has a fleet of volunteer drivers, and under Ralph's leadership, this fleet has grown into quite an army, and they will continue to take veterans to essential medical appointments. That will continue to happen. The vehicles will be wiped down before and after each trip to keep the surfaces clean. Counseling is incredibly important right now when people have questions about benefits, about other sorts of help that they need. We're not going to do it in person right now. It'll happen over the phone. So if you're a veteran, you need services, you need help, you need counseling, please call 516-527-6565. If you're a veteran or anyone who needs any kind of help or counseling, our DSS helpline is open 24/7, 516-227-TALK. We know people are struggling if they have mental health issues, if there are addiction issues, right now perhaps more than normal, so you can always call 227-TALK. I am now very happy to invite up to the podium to say a few words is State Senator John Brooks.
Thank you. Good morning, everyone. I just first want to compliment the county executive for her actions during these challenging days. She's been out front right away, making a lot of critically important decisions. I think in New York State we're blessed with the approach the governor has taken. He really has taken a very active control. You know, some people a couple of weeks ago, when we gave him some additional powers, was wondering the correctness of that. We're in what would be referred to as an incident command situation. You want one person calling the shots, which is the governor, giving direction throughout the state. We don't want different communities responding in different ways. I think we're very fortunate in how this has been done. We recognize there's a lot of needs now, a lot of equipment and supplies are not available, but you know, we are moving in the right direction, and we'll continue to do that. I think as you see amendments made to the policies, as the county executive mentioned, we'll be closing barbershops and the rest. You've got to keep adding to that list. We've got to get people to be stationary for a while so that we can help reduce the spread. To the veterans themselves, and yet it's critical that this operation is here to serve your needs, to provide food if that's what you need, or guidance. I think this, again, is absolute team effort here at the county level, at the state level. People are doing what's best. We recognize the number of tests that are being given is increasing, and as a result, we're going to see more people identified as having the virus. I think we've got to recognize that really is a byproduct of the amount of testing we want to continue to do. But again, I want to compliment the county executive for what she's done here. She's been very transparent to the community with the information that's needed. We will get through this, but there's a lot of challenges ahead. So again, Laura, I compliment you with what you've been doing. Thanks.
John, thank you very much, and thank you for your service as well to your constituents and your service to our country. You know, we're trying to let the public know what we're doing here at the county to keep you abreast of all of the latest information and all of the facts. And this is a good opportunity to remind that everyone can play a part in this. And we're talking about our most vulnerable residents right now. And this is a good time as any to remind everyone that kindness and reassurance are just as important right now as everything else that's going on. Being kind to your family, being kind to your neighbors, just very small acts can make you feel better as well, not just the person that you're helping. With that, I would like to turn it over to Ralph Esposito, who runs this wonderful Veteran Services Agency.
Good afternoon. I just want to say thank you to all those who volunteer their services to help this program work. We have volunteers in our vet mob. We have volunteers, drivers, everyone. Most of them are all veterans. We ask for volunteers every day. If you're able to volunteer, please do so. And I want to thank all those that help us supply our vet mod. It's very urgent that we have food for our veterans, or for anybody that really needs it. I want to thank the county exec also for what she does for this agency. And thank all those who help us participate in getting this done. I just can't say enough. Our veterans made it possible for all of us to be here. So thank you all, and thanks for your concern.
Thank you very much, Ralph. And now we're going to hear from George Martinez, who runs our Office of the Aging.
Good morning, everyone. I also want to thank our county executive, but also our deputy county executive and our commissioner for the tremendous leadership and support that they have been providing for us all along. The Nassau County Office for the Seniors for the Aging is focused on our seniors. We're here for them. Our centers are currently closed to programs and activities, but they are open to provide support to all of our seniors. Staff is on site, and we ask that all residents, senior residents, families of seniors who have any questions or any concerns, to please call our New York Connect number. Our New York Connect is our main source of information. We want all the phone calls to come into that number so that we can direct the senior, or we can direct the services to the seniors. The number is 516-227-8900. 516-227-8900. The Meals on Wheels program is running on a normal basis. Everything is fine. We have seen no glitches at all. And we want to thank our partners, Catholic Charities and AAC, for doing that. We're also in the process of providing shelf stable meals to those seniors who usually participate in the centers. We're trying to do the best we can for them and provide them a nice basic support. So once again, please, we ask all the seniors and all their families to contact us at New York Connects 516-227-8900. Thank you very much.
Thank you very much, George. There may be some confusion. I transposed the numbers when I gave the Veteran Services number. It's 527-6567.
No, 7
Oh.
572.
Oh,
572.
I have it wrong here. I'm very sorry. 572-6565. 572-6565. Thank you very much for correcting me on that, Ralph. I want to give a special thanks to our nonprofits who are out there working for our most vulnerable. We have Paul Pachter of Long Island Cares, and we're incredibly grateful for the help that he is giving us right here at our Veteran Services Agency. And Paul, if you'd like to say a few words.
Thank you, County Executive Curran. Let me echo what everyone has said before me. We are in a situation here in New York State and in Long Island where we must turn to our elected officials for guidance, leadership, and support. From what I've seen in the past few weeks, no one is doing the kind of job that Governor Cuomo and County Executive Curran and County Executive Balone has been doing to calm the concerns of Long Islanders, those in need and perhaps those that are not in need of emergency food. The governor's declaration, his state of emergency orders that were issued yesterday, as you probably know, exempt the regional food banks in New York State from sheltering in place and staying home. You cannot address this crisis without the support of the 10 food banks throughout New York State. And as we did during Superstorm Sandy and as we did during the government shutdown, we are ready and prepared to assist our neighbors in need. Let me also say, if I may, that we are currently in the midst of trying to deal with two crises at the same time. One, the COVID-19 pandemic, and the other related to increasing layoffs, terminations, and furloughs of people who had important jobs to do but can't do them now. With that, it is conceivable here on Long Island in the next 2 to 3 weeks that we will see a potential 20% increase in the number of our neighbors in need. Currently, there are 259,000 Long Islanders that rely upon the services of the Emergency Food Network. It is indeed conceivable that an additional 50,000 people will be added to that number as a result of the layoffs. Right now, the USDA supply chain of food that comes to the regional food banks, in particular to Long Island Care, since we administer that contract, is strong. It was announced the other day by the president that with the stimulus package that was approved, an additional $400 million is being assigned to the emergency food banks across the country. $300 million worth of additional food and $100 million in administrative support to help us deal with the storage and distribution of the food that's coming in. Right now, I can share with you that of the 349 pantries that Long Island Cares provides food to, 44 or 13% have already closed their doors. The reason they've closed their doors is because the majority of the staff and volunteers that work at the food pantries are individuals who are aging. There are people in their early to mid 70s, and they have to take care of themselves. We also are aware that of the 7 soup kitchens available here on Long Island, 2 have already closed. But I want to seriously help Long Islanders to calm down and not be overly concerned about the availability of food that the food banks have. And in particular, at Long Island Cares, our current inventory is 1,075,000 pounds of food. That's food that's available to our veterans and available to our seniors. This week we received more than 82,000 pounds of food, and in the next 2 weeks we expect an additional 375,000 pounds of food. To date, in the last 2 weeks, we've seen 149 calls come into Long Island Cares. We've seen 10 home deliveries take place. and we have delivered food to more than 1,500 seniors in both counties. We have a deep concern with the homeless. Each month, Long Island Cares delivers food and support services to between 300 and 350 homeless individuals. Last week alone, we supported the homeless, 125 people with food packages. But we certainly have concerns, and the concerns are, as was discussed earlier, we're seeing a shortage of volunteers, with people fearful to come out, volunteer their time at the pantry, volunteer their time at the soup kitchens. There clearly has been a reduction in food donations through food drives, through the store retail rescue program of about 23%. Thankfully, donated food only makes up about 20% of the total inventory at Long Island Cares. The other 80% is food that the food bank purchases. We also have a very strong concern about children. We all know that the school districts have stepped up and are doing the best job they can to address the needs of children who are eligible for the free or reduced school breakfast and lunch program. However, many of those children also rely upon after-school and weekend meal deliveries, and right now we are trying our best to determine how we can provide the food to them as well. And lastly, but not certainly last, is the safety and well-being of our staff at the food bank and the staff at the pantries and the soup kitchens. So, in addition to the $300 million in food that's coming to the food banks and the $100 million for storage and distribution, we really do need to step up here in New York State. And in my capacity as president of the Food Bank Association of New York State, we have already called on Governor Cuomo to consider investing an additional $4 million to the Department of Health's budget in order to provide the additional funding to food banks so we can continue to purchase needed food. So right now, our supply chain, our distribution chain at Long Island Cares is active. We continue to deliver food to our member agencies, all 364 of them. Our agency pickups at our warehouse in Hauppauge are continuing. We are increasing our inventory at all 6 of our locations throughout Long Island because we've asked the public in need of food to please visit any one of our 6 satellite locations. Our satellite location here in Nassau County is at 21 East Sunrise Highway in the village of Freeport. Home deliveries for our seniors will continue. In addition to our satellites being open Monday through Friday, we're opening them in the evening on weekends for people in need. That would include our seniors and our veterans, and that's by appointment only. And we continue to do aggressive outreach to the homeless. In conclusion, let me tell you that I'm confident that we will have enough food to support Long Islanders in need in both counties, but we stand ready to continue to collaborate with our state legislators and with County Executive Curran to come up with additional ways that we can get the food to the people, including our veterans who come here to the center in East Meadow. Thank you so much.
Thank you very much, Paul. Any questions? Thank you very much.
Great, thank you.